Welcome to my presentation on the development of Children's Hope Hospital. I am Victoria Chahanovich. I attend American University where I obtained my master's in healthcare management. It is important for any institution or developmental project to look around them at outstanding providers of that service and to analyze how they provide their services and how they have become so reputable. In my case, I examined two hospitals who have many accolades with a high reputation in the pediatric world. The first is Primary Care Hospital in Utah, and the second is Boston Children's Hospital. While both of these differ in what they focus on, they really have an overall goal of decreasing costs through using tools to measure quality and outcomes. While the hospital in Utah, Primary Care Hospital, focuses on value-based incentives with their physicians and staff, Boston Children's Hospital focuses on implementation of tools. So what we see within this analysis and research of pediatric hospitals is that you must not only get the providers involved and the staff involved in implementing and practicing quality care, you must also purchase and implement the tools that can succeed to those levels. For example, the Care Coordination Measurement Tool is a tool used by Boston Children's Hospital, and this basically is an analysis tool of seeing what is used for what type of care. This gives a good measurement of what the final cost of care will be for a specific diagnosis and to gain a specific outcome, but it also shows what is not needed, what is being wasted, more specifically in emergency departments, that is leading to higher costs not only for the hospital, but for the patients as well. They also use systems to track benchmark value and outcomes. Although they don't have one specifically related to CMS since they are a pediatric hospital, there are many tools like Leapfrog that allow pediatric hospitals to track outcomes and patients. So it's really important. What we see here is that hospitals of pediatric must prioritize incentives. They must not only focus on the patients, but they must encourage the providers to provide that quality care. And how are you going to do that? That's through implementation of tools. And as well, Boston Children's Hospital has been a leader in research and development. This can make a hospital more attractive to outside patients who may not be able to find care in their area. I think through looking at this, I was able to gain an understanding of what I should, one, spend money on, and two, focus on in the development of my hospital. So really the purpose of creating this children's hospital within this area is to serve the community of Utah, which has a high youth population. But we also want to focus on inpatient and outpatient visits and procedures because our goal is not only to attract patients from around the world, but we also want to maintain that positive and vast patient population within the community, which can only be possible with inpatient referrals referred to our outpatient facilities. We really don't want to just focus on elite clientele, but serving our population, giving access to children who may not have this type of care readily available through the insurance programs in which either their parents or themselves participate in. So it's justifiable to invest in such a hospital to benefit the children who not only surround this immediate area, but those children that are in need of specialized care, which can often be very hard to find. Ideally, the construction of this hospital would begin small with inpatient while we maintain those referrals and populations, and then we would expand out into outpatient facilities, expanding into areas in which we find serve the area in which we are in. So financially, what my hospital needs to focus on is saving money in ways in which we can so we can invest in big developments and technology to improve quality of care, which will reduce healthcare costs. So we're going to try and get involved in incentive programs. Those are working with insurances, underserved populations, possibly using research programs to gain traction for experimental procedures and treatments. We also want to gain some strong administrative departments. We need to have a strong force of financing managers and revenue and billing departments in order to ensure proper reimbursement And then we want to start embracing the value-based programs. We want to educate our physicians and staff that when we participate in these programs as a team, we can see the effect it has monetarily. And also having that wonderful insurance mix will stabilize the hospital for a long time. And some other things, Utah has an incentive for installing solar panels. While it may be costly, and even if the reimbursement is not so large, it will decrease costs in the long term. And this will give us the opportunity to integrate those technology systems using an electronic health record system to increase care coordination and increase quality and decrease those costs and increase the amount we get from incentive programs. As well, we want to follow Eric Topol, who is a leader in implementation of new technology. Things that can be done on smartphones, things that can be done on singular devices. As you can see here, we really have a timeline for the actions and the milestones in which we wish to make within that first 5 years. Although there will be construction, we want to still be actively marketing, advertising, and still recruiting providers and physicians that will fit what this hospital is about. We want to start developing and participating and getting licensed for participation in state and federal programs. We want to use proper utilization, which we'll find during our care coordination tool outcomes. With the goal, we're going to look for quality providers so we can provide that quality care. We can have a strong reputation, not only in the community, but throughout the nation and world. Ideally, we want to get that integration of technology within the first year. Although there will be a learning curve and outcomes may not be exact until later on, we want to focus on this first year, getting those electronic health record systems in, training our employees. Then later on, implementing larger and more advanced technology to decrease pay, which will take time and money to train, but in the long term will be worth the outcome. We also want to participate in incentive programs, which we've talked about. This ideally would be throughout the lifetime of the hospital, 2 to 5 years, getting involved in partnerships with programs. Then, as our hospital grows, as we maintain that inpatient account and those referrals, we can then look to expand the departments that are providing the hospital monetary gain and are clearly in need for the patients in which we are serving. So overall, our goal of this hospital is to provide another primary, large, and advanced hospital within the state of Utah to serve the high population of the younger adult population. Then we also want to focus on providing that quality care. Pediatric hospitals may either be small or large, but they often fail when they are not implemented correctly. So we must look at the hospitals that have succeeded throughout the years to maintain quality, decrease costs, and stay afloat throughout the ever-changing healthcare. Ideally, the support of this hospital through government funding, donors, and foundations, we will be able to carry all of this out.